So in this question, we have a 40-year-old man with a history of AIDS coming in with progressively worsening epigastric pain over the last few days, accompanied by nausea, but does not have vomiting or hematemesis. Mentions that he had a change in medication for his AIDS treatment a few weeks ago, and labs show elevated amylase and lipase. What medication caused these symptoms? A. Ritonavir, B. Abacavir, C. Efavirenz, D. Didanosine. So try to answer the question, and then I'll explain in 5 seconds. Okay, so the answer is going to be D. Didanosine. So for this one, didanosine's known complication is going to be acute pancreatitis. So pancreatitis generally presents with epigastric pain that radiates to the back. So if you ever hear this, just have pancreatitis in your differential. And then for the other side effects that it can have, it's going to be lactic acidosis. So they don't mention it in this question, but just keep that if pancreatitis is not what they present with and they present with a lactic acidosis, it can still be didanosine. And so this one, Ritonavir, so this one's going to be a protease inhibitor. And so the side effects of these types of drugs are going to be hyperglycemia, hypertriglyceridemia, and then lipodystrophy, which is just going to be abnormal fat distribution on the patient. And so, for example, how they would present this type of question is the patient started this medication and you notice that their glucose has been uptrending, so it's been going up. And you might think that they might be getting diabetes, but you realize that they've been on this medication, so you start suspecting that it could be an adverse side effect. And so the next one is going to be abacavir. So it's going to be a nucleoside reverse transcriptase inhibitor. So for this one, the main thing is just hypersensitivity reaction in a small percentage of patients. So nothing too special there. And then finally, efavirenz, which is a non-nucleoside reverse transcriptase. And so the big one for this one is going to be CNS symptoms. So it can be confusion, sleep disturbances, that sort of thing. But in this question, really the one they were looking for is acute pancreatitis. So it lead to didanosine. And the key here is just knowing that the patient had a history of AIDS treatment and that his medication was changed a few weeks ago. So if this patient came into your clinic or your ED, then you would know that it's probably going to be a medication side effect, and you can narrow it down. But in this case, they give you all the different AIDS medications, but then knowing what side effects go with what medication can really help you answer this question. So for this one, just remember didanosine for pancreatitis. And if you watch Sketchy Farm, they also have a good, which is a picture mnemonic device. It has a bunch of different sketches over all of these drugs, so it can really help seal in the details. So I hope that helped, and thanks for watching.